Hello, my name is Pankaj Sharma. I am brother of Romil Sharma, who is admitted here at Ashoda Hospital past 1 week. My brother complained joint pain and we visited Varanasi district, and doctor performed few tests and prescribed some medicines, and after that my brother was fully okay, but he complained the same thing. We visited again the same doctor, but this time the patient was not okay. So I thought to have second opinion, and I interacted Dr. Somnath Gupta here at Ashoda personally. So he told me that you can bring him here. So I thought that would be better to bring him here. So we came here before 1 week ago, and the medication and everything was here was so good. Doctor is so polite, and other things, hospitality is good. Behavior of nurses and staff, including junior and senior, is also good, and I am fully satisfied here, and I would recommend if someone is looking for a better treatment, you can come here. Thank you.
Hi, I am Dr. Somnath Gupta, Senior Consultant Physician and Diabetologist. I am working in Ashoda Hospital, Hi-Tech City branch. So today I will be telling you about an interesting case which I have encountered 1 week back. So he is a patient 27 years old who is from north, who work at a legal service agency, who has been having some problems since almost 15 to 20 years. Since he has been 13 years age, he encountered few symptoms, fever as well as some joint pains which were elevated in such a scenario that he is not able to move. Joint pains are like polyarthritic arthralgia kind of symptoms which are involving multiple joints and symmetrical involvement, more of small joints rather than large joints, and he is almost stuck to a bed with some kind of rashes. He was in a place where the medical facilities are on a minimal edge, and where he did some preliminary tests which showed an C-reactive protein elevated, and he was provisionally diagnosed to be having as rheumatological issues, and they said that he is suffering with rheumatic fever without any proper diagnosis as well as without any fitting into proper Jones criteria. He was started on penicillins which was given every 21 days for almost 7 years. Even after taking the injections and some symptomatic treatment, he had these issues on and off. But since last almost 10 years, he didn't have any symptoms and he didn't approach any doctor. He stopped penicillin injection after 7 years of treatment. But recently, 1 month back, he started having similar symptoms like facial swelling, mainly periorbital swelling, left side unilateral rather than right side, more on left rather than right. He had some complaints of joint pains. Those are gradually increasing with high grade fevers, almost daily pattern. He has been suffering this for 10-15 days. He was taking symptomatic treatment at his village where he couldn't find proper solution. One of his relative is my old patient. He contacted me. I said him to shift immediately. We evaluated in terms of few investigations, finding out the cause, where you could clearly know that ASO titers are normal, as well as we did a specified test for rheumatic fever, like we did a anti-DNSB which was negative. We did a 2D echo, ECG, everything fine to be normal. So rheumatic fever was ruled out. We did a ANA profile which was negative. CRPs were remarkably elevated, which were more than 250. WBC counts were elevated, which were 21,000. Procalcitonin was done, which was almost normal. So this looks like more of inflammation rather than infection. Other causes of joint pains as well as rashes and fever history. Based on this, we did rheumatic profile like RA factor, which was mildly positive, but anti-CCP were negative. So finally we thought it may be one kind of inflammatory fevers. We started him on some anti-inflammatories, mainly etarecoxib and some kind of steroids with some antibiotics, where he started drastic improvement within 1 to 2 days. He stayed in the hospital for 5 days period, during which he had a significant improvement. We empirically started him on oral steroids tapered from injectables, and we started him on some kind of non-steroid anti-inflammatory drugs which was given for 5 days. Then disease modifying anti-rheumatic drugs, hydroxychloroquine, methotrexate, and we started on leflunomide, which he was maintaining, and he had a follow-up after discharge for 15 days. Almost 2 follow-ups were done, where he said he is very happy with significant improvement. So this finally the take home message is, there are few problems where we can't find the solution. When the symptoms has been chronically, we need to properly evaluate, and we can start empirically if there is no proper conclusion based on the clinical signs and symptoms where we could find a significant result. Thank you.